PSR is a psychosocial rehabilitation program that we offer the service to elderly and adult services with emotional and mental illness. The criteria for the elderly, it consists of 50 and older, and we have to have some simple things like medical eval, and that's to get them started. We have to have a communicable disease test, TB test, and being willing to participate. The adults is basically the same, but the only thing, the criteria is a little bit different. The criteria for the adults, we only need to make sure their prior authorization is effective and able to come, because the insurance company is the one that states whether or not they okay to come. Besides the assessments that we do, a lot of the assessments with the criteria with them is emotional also, and a mental illness. We do assessments, so that would be one thing. When they do that, we like to know a little bit of information about those individuals prior to coming, because we want to make sure we're going to do them a service as opposed to a disservice. Our average day is starting off, we do breakfast, and we start off with initiating them and the staff engaging to make sure they're all there. And we do evidence-based criteria with different activities, socialization, written activities, visual activities. We do think and talk in both of them. And that means they get a chance to express their feelings about whatever, feeling checks. And then after we do those group activities, there's always someone that want to elaborate or express. So we let them express their feelings a lot, because they give us an insight, maybe a possibility of something may or may not be going on with them. So that's one of them. And the other one, we do a lot of recreational, and that would be like a little exercise, a little music, because as you know, music does a lot of things for different people. And we initiate those things to give them an option to build their self-esteem up, or give them an option to know, although I have an illness, mental or emotional, I'm able to participate, I'm able to go out into society and still be productive or successful in what I do and feel good about themselves. That's the main goal. We want them to feel good about themselves. We also talk about medication. We want to make sure that their stability, that's the most effective part, is their stability. So we do a lot of stability things and make them informed, and we also have in-service from outside individuals. I like the program because it's not only for the clients, and it helps me as a person also, letting us know, even if it's 2 or 3 people that has been stable for years or stable for a month, when you've seen them come from episodes in state hospital, and then after 6 months or a year or 2, and you see the big difference, that's like a joy, and you can see that your work that you're doing is working. You're succeeding at helping. We offer transportation. We pick up and drop off from their homes in the city limits. We don't go outside the limits. You can refer from in-house most of the time. They're from case manager, therapist, doctor, anyone actually can refer to the services. But when you're referring to a service, we want to make sure that that individual, they're going to be right for the program.